this is the best way that I could explain this, because this is one of those tricky things. Like, it's really important to know, why do I need what data and what is it used for? And so these are the 3 scans that we need to acquire. And I'm gonna go through this kind of slowly and then let you guys ask questions. But scan number 1, you have a master cast with scan bodies on it. This is the one that your lab can do, right? Because this is the one that has to be done with a box scanner, that master cast with the scan bodies on it.
Those are lab scan bodies. They're different than the ones you're going to use in the mouth.
Yeah.
That's an important distinction.
Yep.
Right?
Those are lab scan bodies. They're plastic or PEEK or whatever.
Yeah, they're like yellow, off-white.
Yep.
Right, they're kind of a taupe color, right?
Yep.
Is that S or?
Yeah. Yep. So those are desks. Yep. And I do this part myself just because we got a box scanner. We got 6 desks, lab scan bodies. I can throw them on the Mastercast, throw it in the box scanner, hit scan, and it creates this. But if you don't have a desktop scanner, your lab is going to do this once they receive the Mastercast. They're going to put scan bodies on, do the same thing. So just think about this scan number 1. This is the one that you can get or not get. Scan number 2, this is an intraoral scan of the patient's temporaries in the mouth. So with your intraoral scanner, iTero or whatever you're using, you have to grab a scan of their temporary in the mouth. This is your bite. So this is how you know your bite. The 3rd scan is the temp on the Mastercast. So remember I said after you pour up the Mastercast, make sure the temp is on there and go grab an iTero scan and get a little bit of this data in there, that stone base, because this is the important part here. Before you give it back to the patient, scan that temp on the stone. And you can do that with an iTero or an intraoral scanner.
Did you do that also with the desk scanner?
Yep, absolutely. Yep, you can just throw it in the box scanner and do the same thing. So yeah, and I'd probably default to the box scanner if you have one, but if you don't, you can use an intraoral one and just make sure you get it.
To send to the lab.
To send to the lab, yep. And the reason is because we're going to take these 3 things and we're going to marry them all together. So you got your bite, you got your stone base here, and your stone base here. So the important thing is the commonality points are in the stone base on this one and that one. And that's how you're going to bring everything together. So,
excuse me.
Yes.
Except for iTero, that can do the 3rd scan, my clone beam has a scan function. Would that be good enough too, or technically no?
I think yes. Yep. I think absolutely. Because the accuracy of that scan is not critical. Because what's critical as far as accuracy? The one that's really critical is this one in the box scanner. That's getting your implant positioning. That's the one that you gotta have that accurate, because that's what they're using to relate every implant to each other. But for that one, I haven't done it, but my gut tells me that would be fine. Okay, so watch this process, because I kind of tried to break it down. We're going to go into this slide. I'm going to hit play here and watch a video. But watch it stitch number 3 to number 2 using the teeth. So remember, 3 to 2. So it's going to take that scan, and it's going to use the teeth as data. So the red is going to go right over the yellow, and it's going to stitch with that yellow. Now, I did this manually. Obviously, the stitching process is actually like a snap to using reference points. Yeah, I'm in Blue Sky. And I just screen recorded this because I wanted the concept of like, how are we getting all these together? But basically, we're taking this one and we're putting it on this one so that these teeth are matching up to those teeth, because that's our bite, remember? So now we get, now you have the cast stitched to the opposing. Now the last one is, now we're going to stitch 1, 2, 3. So the blue is going to go to the red now. So now this blue one goes onto the red one. And now the whole point of that was to get to that. Does everyone kind of follow? The whole point of this whole process was to get the master cast with the implant positions in a bite reference to the lower arch. Good? So this went to this, and then this went to the red one. Does everyone kind of follow that? That's why we need those 3 scans. Because I remember I was walking through this with Jared, and it's like, wait, why do I need that scan? How does it work? So this, I tried to like put a graphic together so you can see.
There's a way I can do it without this crap?
Yeah.
Nobody said that.
Probably. So you're not actually going to be physically doing this, but it's really good to see like, okay, what is the lab actually doing so I can get them what they need.
Yeah, because you really can't do these cases. Once I understood, once you know, okay, now I get what's happening.
Yeah.
You just can't navigate these unless you know what your lab ID and what you're supposed to do next, right? It's like trying to figure out the Wackerman appointment in dental school, what the hell that was for. Once you finally grasp that,
Yeah.
like, oh, now I get it.
Yep.
Right?
Exactly. So same thing. It's just what are they doing in the digital world so I can get the data that I need. And the key aspects here really came down to this, because that temporary on the master cast where you had some stone references is how this one got to match up to that one, because those stone references are the commonality. Those are the stitching points. And now they can actually bring in that stone into occlusion and do a full design.
I mean, that's all the lab needs, and now you're going to get your final back, right?
Your original temp design is a Blue Sky Bio design, correct?
Yeah, in this one it is.
Yeah.
And so
then you send the data to the lab. They're gonna do now what, ExoCAD?
Yeah.
Like mirror or kind of copy what you have already.
yes, exactly. So you're gonna have the temp overlaid over the scan bodies, and that's why taking some photos is good, because what if your temp was way off, right? Now you have a photo and say they have the temp on the screen and they have your instructions like, hey, bring the lower incisal edge down to the left and put the upper teeth this way. But now they have some sort of reference to change on that design, because the temporary is in the scene, the digital scene.